Let me show you how to finish an Invisalign case with smart clincheck planning with a minimum of refinements and attachments. So this case started on the left, and you can see it's an edge-to-edge occlusion anteriorly, almost a crossbite. And going along with that is a lot of anterior wear. So the patient came to me because they wanted to perhaps lengthen these teeth, or at least the dentist felt the occlusion was traumatic, leading to this wear. So we want to finish with the upper teeth outside of the lower teeth. In addition, we want to have a more aligned dentition for better hygiene and for aesthetics. So now this is where we are over here on the right. This has been about 5.5 months. Now, we're not really having these as far forward as I would like. I'd like to have the uppers clear of the lower. So you can see they're still kind of in that occlusion, but better than they started. But certainly you can see the teeth are aligned much better, top and bottom. But there's still some work to do. So now I'm faced with refinement. And so this is what I want to show you. The case came back, and I'm going to click the modify button. So now let's break it down. So the first thing I noticed is that if you look at the upper anteriors in this plane, can you see how they are moving down? Now, in order for that to happen, you'd have to have attachments on those teeth. But not only is that something that patients don't love, but the question is, do we need to move them down? Because remember, we might restore the edges of those anteriors. We don't need to bring the gingival margin down. And so I'm going to remove that extrusion, and I still will meet the goals of my case. In addition, this is subtle, but if you look at the upper right central, do you notice how the mesial incisal is coming down more? That's contributing to a dark triangle there. Now, we don't need that. So what I'm going to do is I'm going to remove a little of that extrusion, and I'm going to remove that root angulation. Because remember, whatever happens at the incisal edge is happening at the root, and that requires a lot more power. Okay, now let's look at this central. There's some extrusion that we don't need. Now we're going to check the overjet when we're finished. Okay, now that's intrusion. That's better. There's some rotation. The root angulation looks okay, but look at the lateral. The reason that dark triangle is getting wider is because the lateral is moving down on the distal incisal. Perhaps that might have been on my original clincheck that I approved, and this is just taking it to that point, but then you have to adjust. Why would I want to have an increased dark triangle? And cosmetically, getting this edge to come down isn't going to change much. So I'm going to remove that distal root torque, and I'm going to remove the extrusion. Now we're going to go back and look at the occlusion. But the goal of aligner treatment is to keep the teeth fitting in the aligner. So whenever you can make more simple movements, you'll do that. Now here's a classic example. Why does that root need to go distal? See the distal root angulation? And so now I have no dark triangle and there's no extrusion. Now I have to extrude the canine, so I'm going to add an attachment on that. So now, if you look at this, now I don't see any movements on the upper anteriors. And for anyone who's really following along closely in orthodontics, perhaps, when you extrude teeth on the top, you decrease the apparent overjet. So right now I have more clearance than I did before I made those adjustments. And consequently, I had actually added some space distal to the canines that I'm going to remove. Let's see what we have. All right, so now we have, I'd like maybe a little bit more overjet. So I might just open a little bit of space here. That will not be visible to the patient. It will be cleansable at that part of the mouth. And now we have the proper overjet with a little IPR. But the main thing was keep the movements simple if it doesn't affect the outcome of your treatment.